defining womanhood is just a project of someone who identifies as a woman.
Yeah, but what do they identify? That's what I'm saying. What do they identify as? They identify as a woman, but what is that?
I honestly don't know.
I am hot and I am bi. And I have mental illness.
You don't know what you're talking about. You're not educated on genetics.
Would you like to discuss the genetics or no?
Well, no.
What are your genetics?
So I'd stay away from the genetics and back to the brain scans.
You cut that out now, or you'll go home in an ambulance.
Excuse me, it's ma'am. It is ma'am. You need to settle down and mind your business, okay? Ma'am. Once again, ma'am. I said both of you. No, you said sir. Once again, it's ma'am. I actually said both of you guys. Right beforehand, you fucking said sir. Motherfucker, take it outside. If you want to call me sir again, I will show you a fucking sir. Motherfucker.
Why are you cutting there?
Right here?
Yeah, why?
Because it's scar, Jess. I don't like it.
Yeah, but there's scar everywhere. If you don't have to cut this, why would you cut that? We can just advance it to there.
Jess, let me go.
But it doesn't make any sense. Why do you need to cut that?
Because this is a disfiguring scar.
How do you know it's not a disfiguring scar? That's just a sulcus. These are the two labia. I mean, you may be right, but we don't know.
Jess,
why don't we just open this up and then see what this looks like?
Let me go, Jess. Let me go.
We have 5 children's hospitals in the United States promoting that.
What?
That's a phalloplasty. That's a bottom surgery. We have 5 children's hospitals in the United States telling girls that they can be boys at $70,000 a pop in a surgery that has a 67% complication rate. That will kill me from infection, that I can't sue on. We're butchering a generation of children because nobody's willing to talk about anything.
Hello, everyone. In June of 2022, Matt Walsh released his investigative documentary, What is a Woman?
What is a woman? Can you tell me that? Well, you're at the Women's March. You must have some idea. Please, if one person could tell me what a woman is.
You are not here for women. We ask you to leave.
What is that?
Being the curious inquirer that I am, I decided to watch it. And it led me down this rabbit hole of gender politics. And I did my own investigative research. And this is what I've found so far. Jamie Reed wrote in the Free Press about her experience at a transgender clinic. Reed said that children who visited the clinic had other co-occurring conditions, such as ADHD and autism, and rarely fit the bill for gender dysphoria. Instead, they seemed to be enthralled with the idea of transgenderism because of its supposed social benefits. The doctors put hundreds of patients on hormonal treatments and recommended many for surgical procedures without fully vetting the patient's mental or physical health. A colleague emailed Reed about a 15-year-old male patient who was put on bicalutamide, which is a medication used to treat metastatic prostate cancer, and one of its side effects is that it feminizes the bodies of men who take it. The center prescribed this cancer drug as a puberty blocker and feminizing agent for boys. And as with most cancer drugs, bicalutamide had a long list of side effects, and this patient experienced one of them, liver toxicity, that could lead to liver failure, which can be life-threatening. He was sent to another unit of the hospital for evaluation and immediately taken off the drug. Afterward, his mother sent an email to the transgender center saying that they were lucky her family was not the type to sue.
If someone asked me why I used to be a boy and now I'm a girl, I would say that I have a girl brain and a boy body.
This is Jazz Jennings, who I'm sure some of you have heard of. She was given hormone blockers at age 11. Now, some people might think that's fine and that there should be no age requirement. However, the person who is leading this gender-affirming fad, Marcy Bowers, a trans surgeon and a trans woman, admits that hormone blockers and puberty blockers harm youth who are pre-surgery and prepubescent.
The second was an observation that I had that every single child or adolescent who was truly blocked at Tanner stage 2 has never experienced orgasm. I mean, it's really about zero. These are to be answered questions. So can we avoid puberty and get good adult results? And secondly, how do we assure someone that they're going to be able to be sexually responsive? Do we remove the blockers during the course of their adolescence and let a little bit of puberty come back? Do we delay it a little bit? Maybe into Tanner's 3 or 4, maybe before they have their first orgasms, maybe.
Jazz has had a very difficult surgical course. She had a very incredible first surgery. It went seemingly very well, but there were problems. And that prompted a second surgery, which I was not a part of, unfortunately. Yeah, this has been a real journey, hasn't it? Mm-hmm. You know, we knew it would be tough. It turned out tougher than any of us imagined.
Marcy Bowers had also performed reassignment surgery on Jazz Jennings, and there have been multiple surgeries for cosmetic reasons. Jazz Jennings explained that there had been discomfort, fear of never having an orgasm, and disconnect with her own identity. I think one of the main issues I see with the surgery is that there's no coming back. Only after you've been on hormone blockers and puberty blockers, and after having a life-altering surgery, do these medical professionals recommend therapy and counseling.
Under the circumstances, do you think it was important to you for a little mea culpa?
I'm not sure. You know, it's nice to hear I did something acknowledging that. On the other hand, there's the medical side and an expectation that really should have been met.
I never fit. I was an alpha female, a sales executive that kind of just didn't fit in any box. When psychologists or somebody that I was in love with or whatever said that I was in the wrong body, I started to think, well, maybe I am. I'm a biological woman that medically transitioned to appear like a male through synthetic hormones and surgery. I will never be a man. Is it transphobic for me to tell the truth? Why is it that a couple hundred years from now, if you dug up my body, they're gonna go, yeah, that was a woman, had babies.
Can you tell me about the procedures that you had?
I've had 7 surgeries. I've had 1 stress heart attack. I've had a helicopter life ride with a pulmonary embolism. I've had 17 rounds of antibiotics. I had 6 inches of hair on the inside of my urethra for 17 months. Nobody would help me, including the doctor that did this to me because I lost my insurance. I get infections every 3 to 4 months. I'm probably not gonna live very long.
Was there any real discussion of the risks and the side effects and...
No, there's not. And I know that people want to think that there is, but there's not.
But surely there are benefits in affirming someone's identity through surgery, right? Well, The Guardian, in an article titled Mistaken Identity, asked Birmingham University's Aggressive Research Intelligence Facility, ARIF, to assess the findings of more than 100 follow-up studies of post-operative transsexuals. ARIF, which conducts reviews of healthcare treatments for the NHS, concludes that none of the studies provide conclusive evidence that gender reassignment is beneficial for patients. It found that most research was poorly designed, which skewed the results in favor of physically changing sex. There was no evaluation of whether other treatments, such as long-term counseling, might help transsexuals, or whether their gender confusion might lessen over time. A growing number of post-operative transsexuals are scathing about their medical care, and international research suggests that 3 to 18% of them come to regret switching gender. And if you think that's not enough, The World Professional Association for Transgender Health, WPATH, removed age requirements for gender-affirming treatment and surgery. This followed a leaked draft version of the organization's recommendations indicating WPATH's plan to lower the age from 16 to 14. WPATH has also ceased to provide an age recommendation for gender reassignment surgeries, instead indicating that they could be considered in minors. Quote, there may be a benefit for some adolescents to having these procedures performed before the age of 18. The Society for Evidence-Based Gender Medicine estimates more than 300 clinics and medical offices in the US provide hormonal interventions to minors. So, another question I have is, why would these medical institutes push for hormonal interventions and surgeries for minors? Well, there happens to be a US sex reassignment surgery market. In fact, the market size is over $2 billion and is estimated to grow to $5 billion in 2030, with a growth rate of 11.23%. And the funny thing is, we actually know who is profiting from this. It's the same US institutes who are promoting hormonal treatments and sex reassignment surgery. Why wouldn't they promote these treatments? They know that the media is already convincing people that it's safe, and all they have to do is welcome confused children into the operating room and mutilate them, and continue to do so for cosmetic reasons. It makes sense why they're lowering the age requirements for reassignment surgery. They know that an average of 80% of gender dysphoric children ultimately decide not to continue into adulthood as trans, and so they push for these younger age requirements in order to turn confused children into permanent patients. Now, hearing all this can be shocking because essentially these children are being used as science experiments. Gender reassignment surgery is an experimental treatment. And in my opinion, this is the new lobotomy because people are trying to tackle psychological distress with physical action. And similar to the lobotomy, there are patients who turn out well. However, the majority of patients become much more ill and even die. And the long-term effects of the lobotomy were only seen 5 to 15 years after the matter, similar to the long-term effects that are affecting trans people now. And the discovery of the lobotomy was also given a Nobel Peace Prize, and we can see the same acceptance and pride with the trans community as they've received so much positive support and attention in the media and even in our educational systems.
To everyone celebrating Transgender Day of Visibility, I want you to know that your president sees you. Jill, Kamala, Doug, our entire administration sees you for who you are, made in the image of God and deserving of dignity, respect, and support.
"20 lengths of the pool, 20 points on the line for the winner here at the NCAA Championship."
Expect Leah Thomas to go out fast.
Leah Thomas pulling away over the final 150 meters. Had to work for it. She was pushed over the first 350 meters. Thomas wins the NCAA Championship. Ended up very close for second, with Wyatt taking it ahead of a late charge from Erica Sullivan in third.
I'm sure some of you have also heard of Leah Thomas, a trans woman athlete swimmer who has caused a lot of controversy concerning whether or not trans women should be able to compete in women's sports. Leah Thomas competed on the UPenn's men's swim team from 2017 to 2020 and on its women's swim team from 2021 to 2022. And in March, she became the first openly transgender athlete to win an NCAA Division I national championship in any sport after winning the women's 500-yard freestyle event. Although Leah Thomas is taking measures such as hormone blockers and estrogen to lower testosterone levels, they're still swimming at the same speed as they were swimming when they identified as a man, and in some cases are swimming even faster in the women's division. Laurel Hubbard, also a trans woman athlete who does weightlifting, set a New Zealand junior record in 1998 as a biological man for weightlifting and started weightlifting again as a woman in 2017. At the 2017 Australian International and Australian Open in Melbourne, she competed at the heaviest category, winning the gold medal. And in 2021, Hubbard met the requirement that the International Weightlifting Federation set for trans athletes and was soon selected for the New Zealand Olympic team. All this, mind you, at the age of 43. Personally, the topic of trans women competing in women's sports bothers me quite a bit. As a student athlete myself, I have a great deal of respect for women's track and field, mainly because my high school had a great track and field team in both the men's and women's division. And seeing how much work these athletes put in is inspiring. And to see trans women dominate the sport and push real women out of scholarships, awards, college acceptances, and even a chance to compete on an Olympic level is disgusting.
The first race that I competed against a transgender athlete was during my freshman year. And once the gun went off, the two transgender athletes took off flying and left all of us girls in the dust. Throughout all 4 years of high school, I was forced to compete against biological males. I only competed against them in the sprinting events, but I raced against these athletes over a dozen times throughout the years, and every single time I lost.
Did they inch you out of medals that you would have won otherwise, or trophies you would have won?
They beat me out by 20 meters out of medals, and qualifying spots, I missed out on qualifying for New England's. I had to go in the long jump and the 4x200 meter relay, so I was forced on the sidelines in my own event, and if they were not there, I would have been able to qualify. So I missed out on so much throughout my high school career.
Did they win all the events or almost all the events?
Between the two of them, they won every single event they competed in.
How does that feel?
It is so frustrating and heartbreaking because we elite female athletes train so hard to shave just fractions of a second off of our time. And going into races knowing that we will never be able to win.
Feels like all that work gone to waste?
It does. After so many losses, it just gets to the point of, why am I even doing this? Why am I keep training so hard and sacrificing so much just to place third and beyond?
I will say I do not hate trans people. In fact, I hope that they get the care that they need and find a breakthrough in their gender dysphoria. I hope that there can be an understanding that life is complicated and that there are other reasons as to why someone does not feel comfortable in their body. This video is not an attack. It is a way for people to understand the difficulties that people go through when transitioning, the lack of support given to those who suffer, and the false and biased scientific data that exists, as well as the people who will benefit from delusion. There are men who present as feminine and women who present as masculine. But to push on these fabricated boundaries to say that anyone can be anything at any time is ridiculous, and it's dangerous. There are more subjects I was not able to cover in this video because I don't want to be stretched too thin in my knowledge or understanding of things. And so maybe in the future I will make another video. But for now, I'm very grateful and thankful that you've watched to the end, and have a great day.